Hello, welcome back to Modern Dentures. In this video we're going to be taking some impressions for a part denture. We've got the first impressions done here, and these are going to be silicone putty based impression material, and we're also going to design the metal frameworks on the existing model. So I'm going to show you how to do that probably in the next video and just explain what I'm doing and why I'm doing it and where I'm putting the clasps, etc. So I'm going to do the upper impression first, and I'm using putty to do the border mouldering as I usually do. Border moulding as I usually do. I tend to put more where the tray is shortest because that's where we're going to need the extensions, and I always blend the putty in well to the tray. Just relax your lips for me. Relax your lips, nice and relaxed. You okay? Relax your lips for me. That's it. So as you can see, I'm just pulling the lips and the cheeks out and manipulating the putty to allow for all those frenums and the mucocompressive tissue, mucostatic gum tissue to be extended and pull away so that we can see the movement and it picks it up in the impression. I'll explain that a little bit better when we take the impression out. But one thing I do when I've put the tray in, I'm just adapting it to the tray as well to make sure that when we take it out that this is locked in fully to the tray and there's no movement there. As you can see, we've picked up some of the teeth in this impression. We can't do the wash impression with these teeth still present because then it will compress those teeth and distort the image. Just using a scalpel. Sometimes I use tweezers as well, and I just remove any areas that are touching the teeth. I will usually take it off of the front area as well, where the rugae is, and the reason for that is, I'm not sure why, but for some reason you always get more compression in that area and sometimes a little bit of the palate out. But all the time, whenever I'm taking the material out, I'm very conscious that I'm not loosening the silicone from the actual tray itself. We need to make sure that it stays locked in. Now it's a good idea if you're just starting to use this technique, is once you've done this bit, is to just check it in the mouth, make sure that it's going in the patient's mouth easily. Generally, if it comes out easily, it's going to go back in easily. If you're taking it out and it feels a little bit tight, then you might want to check it just before you put it back in. Now I've been doing this for years, so I tend not to check it anymore. I know whether it's going to go in easily or not. So once we've done that, then we use a light-bodied wash to pick up all the detail. This is the tricky bit, making sure that you don't overload the tray, but also you want to make sure that you're not underloading it, which can be even worse, because if you get a big bubble, it's a lot of work to then cut all the teeth out again and do another wash. Quite often what I'll do as well is I'll use a really light bodied wash in and around the teeth area, because this is a lot more flexible and it will mean that it's easier to take the impression out, especially if there's those interdental spaces between the teeth. And I use a mouth mirror. Just relax your lips for me. I use a mouth mirror sometimes just to pull the lips aside, but usually just have it at hand, so if any material does come out the back because you overload the tray, you can quickly scoop it up. And remember to always guide the patient with relaxing their lips, because it's a natural tendency when you're putting something in their mouth for the lips to pull up and pull back, and that can also make it more likely that the material's going out the back of the tray rather than out the sides of the tray where we want it. We want it to come up over the flanges, the special tray, into those sulcus areas and not out the back. Taking an impression of the throat is not a pleasant experience for the patient. As always, I'm putting the material on my glove so I can just check the setting of it. when I'm putting impression in the mouth, put it at an angle so that I'm not trapping air in. So I push it up at the front first, then I'm tilting it back so that it starts to flow out the back, and then I push it up fully at the front to then try and get the material to push up over the front into those labial and buccal areas. When it feels like the material's set on my glove, I always just leave it a little bit longer, because sometimes, especially if you're doing a thick impression, it won't set as quickly around the teeth areas, typically tips of the teeth, and then you'll get a distortion. So once it's set on your glove, just leave it a little bit longer. Unless the patient looks like they're in distress and they're struggling, then maybe you'll want to take it out a little bit sooner. However, the risk with that is if you do take it out too soon and it's not set properly, you're going to put the patient through the impression again. So keep your lips nice and relaxed for me. Will feel a little bit tight because it will lock into the teeth a little bit, okay? There we go. So we've got the perfect impression. We got a little bit of distortion here, look, between the teeth. So when we took it out, when we removed the impression, this is where the material is bridged between the teeth. So it's gone through that interdental space and linked together. So then when we come to pull it out, it pulls these areas and they will always be distorted. The only way you can get around that is using something like the Coldacell to block out those interdental spaces before you take the impression. But if it's just little gaps like this, then I tend not to do it, because these bits are not used anyway. And we just get some scissors and then we just snip those little areas out, and then we just get a pair of pliers and just remove those little bits. Same with this one, but the light bodied, I tend to start on the back exterior part and then just tease it all the way around like that, and then I'm making sure that I'm wrapping it around the tray, especially on those back edges, because that's the area where it's going to pull out, if anywhere. Relax your lips for me, that's it, keep them nice and relaxed, and just poke your tongue out a little bit for me. There we go. Again, what I'm doing first, I'm just manipulating all the impression material down into the sulcuses. Just keep your lips nice and relaxed for me, that's better. So essentially what we're doing with this border moulding technique is we're trying to actually compress those static tissues and the compressive tissues a little bit, but not too much, not heavily. This isn't a functional impression, at least not to my standard that I would call a functional impression, but it is relatively functional again. So with this one, so you can see the teeth, this will be a tricky one, taking this tooth out, just because the tray is going to be a little bit small in this area. Just whiz round like that. This one's a little bit easier, but I'm using a scalpel, and the type of scalpel I use is this shape. This is a 10A. Basically it's a triangle one, not the rounded one, because I know a lot of dentists use the rounded scalpels. I just find this a lot easier to remove the material, and that's the thinness of the blade to get in and get a nice clean cut. So if I'm doing a fully functional impression, I would use a lot less the putty material, because although it's soft, it does create a bit more compression. What I'd probably do is just put a little bit on there just for the soft material to key into it, and then I'd do a light body wash and build it up in layers that way, but do lots of washes, taking it in and out and building it up. Maybe I'll do a video of that one day, but I tend not to do it that much because I don't really feel like you get better results than the way that I'm doing it. That might be because you're taking it in and out so much, there's a risk that when you're putting it back in, that you might not get it in the correct place. Sometimes you get you know, you get a distortion there, and it's almost impossible to see those distortions unless you're using different coloured silicones like I am here. So once you've taken the wash and you take it out, you can see it's thicker in one area than it was in the previous wash. Just relax your lips for me. So you might see that the impression's then thicker on one side than the other because you've not seated it back into the same position, and then that's a distortion. The only way to fix that is by starting again. You remove all the silicone from the tray and then do the border moulding again, just start from scratch basically. And it's so easy to do. So I feel like the least amount of times that it goes in and out of the patient's mouth, generally I'll get better results. And the other thing that a full functional impression does like that is it doesn't displace any of the tissue. So it's picking up all the tissue in its natural relaxed position. And if you make a denture that doesn't displace the tissue, as soon as the patient bites down, it will then compress the tissue, and then you end up having to do adjustments and things like that. Keep your lips nice and relaxed for me. Again, it's going to be a little bit tight coming out. Not too bad. And another perfect impression. Sometimes it can come a little bit short here, but that's good. You never want to put a denture back here anyway, because that will just cause problems. You can see, you know, we're picking the frenums up nicely either side, and there's a good displacement of the washes. There's no obvious areas. Underlying putty is pushing through. This is what you're looking for, is areas like this in the lingual side. If it looks bulge, it's okay if you see the material underneath, but if it looks like it's bulging and pressing in, then I would be tempted to do this impression again. I would use a scalpel and just cut all the teeth out, and then just use a really light bodied wash like the orange colour, just to do another wash to pick it all up again. And it's worth doing again. Any little distortions, if you see them and ignore them, it will be a costly mistake, because it will mean you either have to make the denture again, or you're going to end up doing lots of adjustments to try and correct it. And any bits like this, I usually just remove those as well with a pair of scissors or the scalpel. I've got a lot of material wrapping around the tray as well, keeping everything in place, so that's good. If it's not, and I feel like there's some areas that's a little bit loose, I'll just get a bite registration material, silicone one, which will bond to it, and just kind of go over it just to lock it in. In fact, I don't need to lock this in, but if I just show you, I use the imprep. And then one of the common things that I might do, just squirt the first little bit out, just purge it, is just go round and just lock in like around the handle, for example. That just means when we're casting this impression up, nothing's going to move, and keeps it all nice and locked in. There we go guys, hope you found that video useful. If you did, like and subscribe, and we'll see you in the next one where we're going to be registering the bite.